Welcome to this video on Myasthenia Gravis, Nursing Mastery. We will be covering comprehensive nursing knowledge for competitive exams, presented by Mr. Nagesh Sir of ND Nursing Coaching. Myasthenia gravis is an autoimmune disorder characterized by the destruction of which receptors? The answer is acetylcholine receptors. Autoantibodies attack these receptors at the neuromuscular junction, preventing proper muscle contraction. Which diagnostic test is used to confirm myasthenia gravis? The correct answer is the tensilon or edrophonium test. A temporary improvement in muscle strength after administration is diagnostic for MG. What is the priority nursing intervention for a patient during a tensilon test? The priority intervention is keeping atropine available. Edrophonium can cause severe bradycardia or cardiac arrest, and atropine is needed to reverse these side effects. Which clinical manifestation is frequently the first sign of myasthenia gravis? The first sign is often ptosis and diplopia. Ocular muscles are usually the first to be affected, leading to drooping eyelids and double vision. A patient has severe muscle weakness after medication. How do you distinguish between myasthenic and cholinergic crisis? The answer is to administer tensilon. Improvement means a myasthenic crisis, which is a lack of acetylcholine. If weakness worsens, it's a cholinergic crisis due to excess acetylcholine. What is the antidote for a cholinergic crisis? The antidote is atropine. Cholinergic crisis is caused by excessive acetylcholine, and atropine is an anticholinergic used to reverse these effects. The thymus gland is often implicated in MG because it is the site of abnormal antibody production. The thymus gland is often hyperplastic or has tumors, acting as the primary source of the anti-AChR antibodies. What is the main side effect of pyridostigmine, also known as mestinon? The answer is increased secretions. Pyridostigmine increases acetylcholine, and cholinergic side effects include increased salivation, diarrhea, cramping, and sweating. When should pyridostigmine be administered in relation to meals? It should be administered 30 to 60 minutes before meals. This ensures maximal muscle strength in the bulbar muscles, facilitating safe swallowing and preventing aspiration. What is a major priority for bulbar-involved myasthenia gravis? The major priority is aspiration prevention. Bulbar involvement affects muscles used for speaking, chewing, and swallowing, increasing the risk of aspiration. What is the ice pack test used for? The ice pack test is used for diagnosing MG by reducing ptosis. Cooling the affected muscle can temporarily improve strength, confirming the diagnosis. Which of these is a contraindicated medication class in myasthenia gravis? The contraindicated class is aminoglycosides, such as gentamicin. These drugs can worsen muscle weakness by interfering with neuromuscular transmission. Which exercise recommendation is best for myasthenia gravis patients? The best recommendation is rest periods between activities. Frequent rest minimizes fatigue, which is a major symptom exacerbating muscle weakness in MG. What indicates a potential respiratory crisis? Weak cough and shallow breathing indicate a potential respiratory crisis. These symptoms suggest respiratory muscle weakness and impending respiratory failure. What is plasmapheresis in myasthenia gravis? The answer is removal of plasma. Plasmapheresis removes the harmful anti-acetylcholine receptor antibodies from the bloodstream, leading to temporary clinical improvement. Which factor is a common trigger for a myasthenia gravis exacerbation? The answer is infection or emotional stress. These factors, along with others like surgery or certain medications, can trigger an acute worsening of MG symptoms. Which nursing assessment is vital to monitor for myasthenia gravis? The most vital assessment is the level of muscle strength and respiratory effort. Monitoring respiratory status is critical due to the risk of respiratory failure in a crisis. What does the term diplopia mean? Diplopia means double vision. This is a common ocular symptom of myasthenia gravis due to weakness in the eye muscles. What indicates the need for ventilator support during a myasthenia gravis crisis? A drop in forced vital capacity, or FVC, indicates the need for ventilator support. A significant decline suggests weakening respiratory muscles and impending failure. Which gland is associated with the autoantibodies in myasthenia gravis? The thymus gland is associated with the autoantibodies. Abnormalities in the thymus often play a role in the production of these antibodies. What is the role of intravenous immunoglobulin, or IVIG, in myasthenia gravis management? IVIG provides passive immunity to reduce autoantibodies. It contains healthy antibodies that interfere with the harmful autoantibodies. Why does muscle fatigue happen in myasthenia gravis? Muscle fatigue happens due to the rapid exhaustion of acetylcholine stores. Repeated muscle use quickly depletes the available neurotransmitter, leading to weakness.